This is Mayowa, a student of the Walden University Nurse Practitioner Program Psych. And here is my volunteer,
Lakita Colkin-Taylor.
All right. So, Ms. Kitty, what brings you here to the clinic today?
I was having some pain in my left shoulder here, and so I wanted to get it checked out.
Okay. How long have you been having the pain?
For about 3 days now, off and on.
3 days?
Mm-hmm.
Is it a new pain or you've always had it?
It's a new pain.
A new pain. So how would you describe the pain?
I'm kind of achy.
Achy?
Mm-hmm.
Is it constant or does it come and go?
It comes and goes.
Okay. What makes it better?
Rest.
Rest?
Mm-hmm.
Have you used anything over the counter or even prescription to help take care of the pain?
I tried some Advil.
Advil.
Mm-hmm.
Does that work well?
It relieves it for a short period of time, but then it flares back up.
It flares back. So just before we proceed, is there any issues with deafness, blindness that may prevent me from doing an effective examination of your health?
No.
All right, good. Okay, so the pain started about 3 days ago.
Yes, ma'am.
It's aching.
Mm-hmm.
It comes and goes.
Yes, ma'am.
Okay, and rest makes it better.
Yes.
What makes it worse?
Movement.
Movement. Okay. Over the last 3 days, has that woken you up? Have you been able to sleep because you're having the pain?
I've been able to sleep kind of fitfully, like
Okay.
tossing and turning a little bit. Mm-hmm.
Okay. Has it affected your quality of life?
I just can't lift heavy things like I
Everything.
used to.
Okay. So I'm going to ask you some questions that
Mm-hmm.
would help me be able to, help with this assessment.
Okay.
Any histories of surgeries, hospitalizations?
I had one surgery, which was a tubal ligation.
Okay.
I had
How
the
long
tubes
ago was
tied.
that?
That was back in 2008. Yeah.
Any recent illnesses?
I had a cold.
Cold?
Mm-hmm.
Did you get the flu?
No,
vaccine?
I got the flu shot,
Shot.
but I didn't get the flu.
Okay, good. Any histories of diabetes, high blood pressure,
No diabetes. I had pregnancy-induced hypertension.
hypertension? Okay. Any history of addiction to alcohol or drugs or any medications that?
No alcohol, no drugs, no medicines.
Okay. So I'm going to ask questions about family histories,
Mhm.
and this has to do with your mom, dad, children,
Mhm.
grandparents. Okay. And
We all have asthma.
asthma. Okay,
Mhm.
so that's the only thing.
High blood pressure runs my family. No diabetes.
Okay.
And I have one aunt that has either cervical or ovarian cancer.
Ovarian cancer.
Mhm.
Okay. So just one aunt.
Mhm.
All right. Okay. So what do you do?
I'm a nurse practitioner
How long have you been a nurse practitioner?
for about 2.5 years now.
Oh my gosh, you like
Yes.
it?
I do. It's rather rewarding. I get to
Yeah.
meet a lot of really great people when I get to help them.
Wonderful, wonderful. So I'm going to ask you a few more questions,
Mhm.
and this is just going to help me determine how best to help you.
Perfect.
All right. Any recent issues with fevers, chills that you cannot explain why it's happening?
No, I had a fever, but that was when I had my cold, and it literally lasted like one night.
So no unexplained weight loss?
No unexplained weakness, no weight loss, or anything like that, though I wish I had it.
Okay. So any problems with blurry vision or double vision?
No.
No.
My eyesight is great.
Okay, good, good.
Yeah.
What about your ears? Any drainage? Any hearing problem? No. Any drainage from your nose?
Only when I had a cold,
Cold.
and it was clear.
Okay, good, good. Any cough that you cannot explain? That is not. Okay,
Just when I had the cold, and then that resolved.
okay. Any bloody sputum?
No.
Okay.
Definitely don't have TB. Yay.
Okay. When was the last time you had a mammogram done?
I have not had one yet.
Okay.
I'm 41,
Okay,
so it's coming up.
Coming
but
up.
Not quite yet.
okay. So any abnormal changes to your breast area?
No, thank goodness.
Good. Do you do self-breast
Exams every
And-
month
And it's normal?
so far.
Good, good. So are you able to move all your range of your legs,
Mhm.
your joints and everything? Okay, good.
Yeah.
Any concerns about anxiety or depression, suicidal ideations?
No, thank goodness.
Good, 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 good. Trying to see what else I'm missing. Any nausea, vomiting, itching, constipation, diarrhea?
No vomiting. Every now and then I get kind of nauseous, but I'm really sensitive to smells.
Okay.
Yeah.
So that,
But no constipation, no diarrhea or anything.
okay. Are you allergic to any medication, food?
I am. I'm allergic to Ceftin. It's an antibiotic.
Okay.
And so I tend to stay away from all cephalosporins.
Okay. Okay, good. Have you ever had any scan done to that right arm that you're having the pain on?
No, not yet.
Okay. Would you be interested in having one done so we can check out what is happening? Since
Absolutely.
Okay, good. The other thing I would like to try, have you ever used a medication called oxycodone?
I have not. I tend not to take anything strong.
Okay.
Just because I'm kind of a weakling and a little, what do they call it? Opioid or narcotic naive.
Okay. Oh, good.
God might pass out or something. I don't know.
Have you ever used anything that has helped for pain, either for surgeries or anything that may have helped?
When I had my last son, they gave me something.
Okay.
And my husband said I couldn't hold my head up.
Oh my gosh.
Yes.
Okay. All right. All right. So thank you for helping me with this assessment. Thank you so much.
No,
All right.
no problem.
So I'm just gonna.
Bye.
Bye bye. Thank you. I'm just gonna look around so you can see.